friends. Welcome back to our channel. Today, our patient is Svetlana. She works as a photographer and, as you can imagine, constantly twisting into different poses for hours each day has taken its toll. Her back pain has reached a point where she's even considering changing her profession. Svetlana says the pain has been nearly constant, especially after long 12-hour workdays. Every evening, her back feels completely exhausted. The main complaint is pain around the middle of the back, near the lower edge of the shoulder blades, close to the spine. Before moving forward, we always collect a medical history. It's critical to ask about trauma, surgeries, chronic illnesses, everything that might affect therapy. Fortunately, Svetlana has no serious injuries or chronic diseases. Her vision is good, no issues there either. All right, no need to delay. We move to the examination. While Svetlana was changing, I reminded viewers to subscribe to the channel and mentioned that starting in 2025, we'll be offering hands-on manual therapy training. Why? Because even after graduating medical school, I realized practical skills were sorely lacking. I had to travel across cities and even countries to learn real techniques. We want to help others skip that struggle. Now, back to Svetlana. During the initial standing assessment, I observed a slight lumbar lordosis, an inward curve at the lower back. Of course, visual assessment isn't enough for a final diagnosis. We need proper imaging for that. I asked her to bend forward, arms relaxed, head down. There was a small asymmetry, slightly higher elevation on the left side. Returning to standing was easy, no discomfort during movement. On closer standing observation, I noticed a mild rotation of the spine. Svetlana tends to lean slightly. Palpating along her back, I quickly found hypertonic areas, painful to the touch, especially near the mid-back. Testing neck rotation revealed tension on both sides. The muscles were tight, but manageable. For self-care, I showed a simple neck stretching technique. Turn the head gently, and using the thumb, apply light pressure away from the spine. It helps stretch and relax the tight muscles. No questions from Svetlana, which is always a good sign. We moved on to a detailed palpation while lying down to remove axial load. On the table, muscle tightness became even more apparent, especially the right side, stiff as a board. She reported significant discomfort during palpation. The paravertebral muscles felt like solid stone. There were also areas causing a ticklish sensation, common when muscles are in reactive spasm. Svetlana, like many patients, planned to go for a massage after therapy, confirming once again, people often seek the easy way out instead of committing to therapeutic exercise. I explained that without LFC, therapeutic exercise, lasting recovery is impossible, but not everyone realizes that immediately. Next, we moved on to percussion testing to check for deeper tension. This confirmed that her mid-back and lower thoracic regions were particularly affected. I suspected a scoliotic curve, a slight leftward curvature in the thoracic spine. Manual palpation, playing the piano along the spine, further supported this. Time for active therapy. We began with shockwave therapy. Applied a cooling gel, yes, it was cold, and set the machine to 2 bars of pressure at 10 Hertz. Svetlana braced herself, but quickly realized it wasn't as scary as expected. Still, areas near the ribs and upper back were highly sensitive. Shockwave therapy revealed painful trigger zones along the thoracic spine, especially on the right side. The discomfort was sharp, but manageable. session, about 1,000 pulses in total, we moved on to manual therapy. We started gently with decompression techniques, breathing exercises, chest mobilizations, stretching the shoulders. We used careful, rhythmic movements to relax her entire back. Svetlana did very well, trusting the process and relaxing when needed. That helped tremendously. Next came spinal adjustments. First, the thoracic spine. Careful pressure restored natural mobility without excessive force. Then, adjustments in the lumbar area, targeted and smooth. After adjustments, we carefully rotated her shoulders and head, restoring symmetry side to side. She tolerated everything admirably, even despite her lively emotions and occasional nervous laughter. We transitioned to spinal decompression. Positioned on her back, Svetlana relaxed as we applied gentle traction. With a strong, satisfying stretch, her vertebrae realigned naturally. Her first reaction? Surprise and instant relief. She felt stretching all the way up into her chest. We repeated the decompression one more time, securing the result. After that, we checked the hip joints. Women often have hidden hip joint restrictions due to anatomical differences. Proper testing showed some tension, but no major blocks. We continued with stretches to target hyperlordosis, an excessive lumbar curve. Strengthening the abdominal muscles will be crucial for her recovery. Finally, we performed a shoulder release, bringing her scapulae into better alignment, working to restore balanced muscle engagement. Svetlana shared her feedback. Shockwave therapy had been painful, but effective. She felt lighter, freer, with noticeably better energy and posture. Even the tension she felt when breathing deeply had lessened significantly. I reminded her, and all viewers, that while manual therapy can provide immediate relief, true recovery requires dedication. Therapeutic exercise must become a regular part of life. Svetlana made the right conclusions, and we're proud of her progress. Thanks to everyone who watched to the end. Please subscribe. Many more interesting videos are coming soon. Health is priceless. See you next time.